Welcome to Tan Tock Seng Hospital. I'm Dr. Salim, a bariatric surgeon from the Department of General Surgery. Bariatric surgery is a life-changing procedure for those struggling with obesity and associated medical conditions such as diabetes. Today, I'll discuss what bariatric surgery is, the common types we perform at Tan Tock Seng Hospital, who might benefit from these procedures, and the risks associated with them. Remember, surgery is only one aspect to managing obesity. It's important to have a healthy diet as well as to remain active to get best results. Bariatric surgery may be recommended to helping individuals who have tried and failed to lose weight through diet and exercise alone, or when individuals have serious health problems because of their weight. Bariatric surgery or metabolic surgery is a broad term referring to various surgical procedures that changes how food passes through the digestive system. By doing this, it changes the signals that control appetite, body weight, and blood sugar. It is these changes that lead to sustainable long-term weight loss. You may benefit from bariatric surgery if you have a BMI more than 32.5 with any other obesity-related medical conditions such as diabetes, hypertension, hyperlipidemia, and obstructive sleep apnea. Or you have a BMI more than 37.5 without associated medical conditions. Other factors such as overall functioning, quality of life, and presence of serious medical conditions will also be taken into account.
There are several types of bariatric sleeve surgery. Sleeve gastrectomy and Roux-en-Y gastric bypass are most commonly performed procedures. These surgeries are done via a keyhole method with 4 to 5 small cuts on your abdomen, through which a videoscope and instruments are inserted to perform the surgery. Gastric bypass, also known as RYGB, involves using a stapling device to divide the stomach into two, creating a small stomach pouch where food can pass through. This pouch will then be connected to a segment of small intestine. This results in food bypassing majority of the stomach and the first part of the small intestine, which in turn restricts the amount of nutrients your small intestines can absorb. Sleeve gastrectomy involves removing between 70 to 80% of your stomach, including the part of the stomach responsible for producing the hunger hormone ghrelin. The smaller remaining stomach results in an earlier sensation of fullness after meals, and the reduced ghrelin levels decreases hunger.
Bariatric surgery carries risks as with all surgeries. It is best to discuss your individual risks with your doctors. In general, the risks are low for most patients, but they can be serious, requiring further endoscopic and radiological procedures. Some of these risks include leaks and bleeding, damage to nearby organs, and blood vessels.
Before your surgery, you will undergo a thorough evaluation to ensure you are fit for surgery. You will be seen by a multidisciplinary team including surgeons, endocrinologists, dietitians, physiotherapists, psychologists, and anesthetists.
You will also need to undergo an upper gastrointestinal endoscopy for evaluation of your stomach. You may also be referred to the respiratory physician for a sleep study if you are found to be at risk for obstructive sleep apnea. You may be required to start continuous positive airway pressure therapy upon diagnosis. You will also receive detailed instructions on how to prepare for the surgery. This will include a 2-week very low-calorie diet known as liver shrinking diet. The aim of this diet is to shrink the size of your liver, thus allowing us to better visualize and access your stomach to improve the visualization of the stomach and the safety of your surgery. It is important that you adhere to the recommendations by the dietitian.
On the day of your surgery, you will report to the day surgery center. You will be checked by the nurses and anesthetists before being brought into the operating theatre.
This surgery will be done via a keyhole method and usually takes between 2 to 4 hours. After surgery, you'll be monitored in the recovery area and thereafter sent to the ward when your condition stabilizes. Majority of patients can expect to be discharged home on the first or second post-operative day. All our bariatric patients are kept on a liquid diet for the first 2 weeks after surgery, which is then slowly stepped up to pure eat, then soft diet. The dietitian will review you prior to discharge to recommend you all nutritional supplements.
Upon discharge, you will also be prescribed medications to protect your stomach and replenish vitamins. It is important you take these as directed.
It is also crucial to come back for your follow-up appointments with the doctors and allied health professionals after bariatric surgery. You will be monitored closely for any long-term complications, followed up for your pre-existing chronic conditions, and advised on appropriate nutrition and physical activity. All these are critical in ensuring that you achieve the best post-operative results. Over 500,000 bariatric surgeries are performed globally each year, and it is recognized as highly effective for weight loss and metabolic syndrome control. However, it is not a one-off solution. Sustained weight loss also requires long-term changes to your eating and exercise habits. If you feel like you would benefit from bariatric surgery, do speak to one of our bariatric specialists for further information. Thank you.